Good evening, I'm Terry Pena, and this is Politics Unplugged. It will cost nearly $1 billion, but could it save lives? Tonight we're digging deeper into a controversy behind Proposition 480. 3TV's political editor Dennis Welch discovered despite the price tag, voters are in the dark.
I don't know anything about it. I have no idea what it is.
It's the billion-dollar question that many voters can't answer.
I've seen signs all over the place. I have no idea what it is.
Proposition 480 would completely overhaul the county's healthcare system, starting with demolishing the Maricopa County Medical Center. And voters will get a chance to decide whether it's worth the $1 billion price tag.
We are going to take care of patients that nobody else wants to take care of.
Dr. Kevin Foster runs the burn center at the county hospital and supports the proposition, saying it's time the hospital gets this kind of billion-dollar upgrade.
The cost of this for each individual is not great. A ticket to a movie and a bag of popcorn, or a couple of trips to Starbucks every year.
It's not a cup of coffee.
Kevin McCarthy runs a tax watchdog group fighting to kill Prop 480. By his estimates, it would cost property owners nearly $865 over the next 27 years. That comes out to roughly $2.60 a month.
There's never been a tax increase that's been proposed that isn't put in the context of it being a small amount of money. Tax increases over our history, they all add up.
However, he worries the public isn't paying enough attention.
It doesn't bode well for us if this is not well understood by taxpayers.
And here to discuss this issue, Kevin McCarthy with the Arizona Tax Research Association, who is opposed to Prop 480, and Mark DeWayne, who is the vice chairman of the Maricopa Integrated Health System. I want to thank you both very much for being with us. We have a lot to talk about, so let's start right here. Supporters say the Maricopa County Medical Center serves a unique population. For example, those receiving government assistance, such as access, because it is the only public hospital in the county. And since it's been decades since there has been any kind of renovations, supporters say this is necessary to keep up with technology and patient demand. Mr. DeWayne, let me go first to you so you can expand on that.
Sure. Maricopa County Integrated Health System, or the Maricopa Integrated Health System, was started in 1874, and we see about 550,000 people per year. A third of those, so 150,000 per year, have no form of payment whatsoever. The other remaining portion, up to the last 5%, are on access, Medicare, Medicaid, and the remaining 5% is about private pay. So you look at the population that we serve that has very specific needs, the unserved, underserved, the sick and the dying. That's what this county hospital was formed for. Couple that with the burn unit and the fact that we won the Behavioral Health Award for the state, the REBA. We're going to build a psychiatric annex as well. So we've got 11 clinics around the valley that see 1,100 people per day. You couple that with what the hospital sees, we're a viable part of the fabric of this county.
Is this money urgent in your eyes?
Yes, it is. I've been studying this since I got elected in 2012. Our facility is 40 years old. It was designed in 1967, excuse me. 1971 we moved in. So you've got a 40-year-old facility that has wall thickness issues, column thickness issues, hallway issues, bed limitations, and it's just not 21st century facility for the medicine that we practice for these people. And I think they deserve better.
Mr. McCarthy, you just heard all of that, and you oppose the measure, saying this will be an unnecessary burden on Arizona taxpayers. Elaborate.
Yeah, and I think the point about it being an unnecessary burden has a lot to do with the incorrect story that the county hospital tells about its role in the provision of health care for the poor. The county tells a story that is consistent with maybe pre-1980 law in Arizona. As every Arizonan knows, we have created an access program that provides health care for the indigent in Arizona. Those people that are on access have access to many clinics and hospitals in every community in the state of Arizona, certainly in the county of Maricopa. Prior to 1980, the county was responsible for the indigent. And so what the county wants taxpayers to do is to pay twice for health care for the indigent. They want us to pay through the billions that is being spent at the state level, and they want us to pay through ever-increasing property taxes in Maricopa County for services that are already being provided in the private sector for these same patients. Private providers in the valley have spoke out in opposition to this. The major providers of health care in the valley, because all of them have signed up to provide those services. So the notion that the county is the payer of last resort, the only place for the poor and the indigent to go, might be consistent with 30 years ago. It's certainly not consistent with the way health care is delivered today.
So, Mr. McCarthy, are you alleging that they're flat out lying to voters?
I think they're telling an outdated story, and that is, I think that's particularly troubling when it results in higher taxes than need to be paid for what is a skyrocketing cost to begin with. The cost of providing health care for the poor in Arizona has been the fastest growing expenditure in the state budget, and crowding out expenditures for education, universities, transportation. We're going to pay more for those things down the road, and what the Maricopa County Hospital wants us to do is to continue to fund an old model. Instead of looking at ways to save taxpayers money, enter into further public-private partnerships, maybe in the area of the burn unit, to try to save taxpayers deserve every benefit to try to save money where they are already spending at the state level for the provision of health care for the poor.
Mr. Duane, let me have you respond specifically to the fact that he's saying, in part, voters are being misled.
They're not being misled at all. We have 150,000 people that have no form of payment whatsoever. No other hospital wants those individuals. Think of it as a business. If I said to you, you can pick up 150,000 extra customers, if you will, and they're not going to pay their bill, who would want that? And so the voters approved this in 2003, its own special taxing district. We are part of the fabric of this community, just like the roads and streets, highways, light rail, all of that stuff. And we're continuing to provide the best medical care that's available to us. We just want to rebuild the building. And we're going to do it for $13.74 per year per $100,000 of assessed valuation on the homeowners. It's a very small tax, and if you look at, Carrie, your personal tax bill, you pay to the school districts, you pay to the community colleges, and way down at the bottom, a very small tax is paid to the hospital. So I think he's being, he's stating his facts, but I don't think he's being genuine in what he's saying from the standpoint of the community value. We had $1.4 billion economic benefit to the county and to the state every year, and ASU did a study for us that over the next 30 years, we will add $36 billion to the state's general fund from the economic benefit that that's going to provide.
One of the things, Mr. Duane, that caught my attention when I was reading the website was that the claim is that this will expand services for the seriously mentally ill. Can you touch on that?
We need to expand services for the seriously mentally ill. We have a waiting list right now. We've got 190 beds that are full. We provided 68,000 bed days last year for the seriously mentally ill, and we are just scratching the surface on serving this population. So those are going to get expanded by building a psychiatric annex, and hopefully we can absorb that. This community is not fit to absorb that at this point in time, and we're trying to do that. That's why the state awarded us the Regional Behavioral Health Award.
And Mr. McCarthy, that's just part of the greater argument that they've been making, that there are desperate needs here that need to be filled.
Well, let me try another way for your listeners to try maybe understand the shell game that's going on here. We are one of 15 counties in Arizona that still has this relic of the past, this notion of a county hospital that is the payer of the last resort. If the things that are being advocated by the county are true and what we're saying is not true, in 14 of the 15 counties in Arizona, there would be no health care for the poor. There wouldn't be access to mental health care for the citizens of those counties. We know that's not true. The county hospital is not the only mechanism to provide health care for the poor. And to Mr. Duane's point about whether or not they have access, they have health care at all, private hospitals are required by federal law to provide service. And the notion that somehow they put these people in a cab and send them down to county might be a story that gets peddled, but that is in violation of state law. And so even for those populations, that there are services that are available to them. There are 5 hospitals within 5 miles of the old county hospital that are staffed by people that are ready, willing, and able to provide services to the populations that the county continues to argue they are the only provider of services for. And I think that's regrettable when taxpayers are spending billions of dollars at the state level to already fund those services, and now being required to double fund those through local property taxes for what amounts to the third highest bond package in the history of the state of Arizona for a relatively narrow purpose special district.
Mr. Duane, do you want to respond?
Absolutely. When Kevin talks about the fact that there's other hospitals within 5 miles of us that are ready, willing, and able to absorb this, why haven't they? The voters approved this in 2003, and we're still seeing that 30% of our population is no pay. Our doctors could go and open a private practice and make more money than they're making right now, and they continue to provide this social type of medicine where they care for everybody, whether they're homeless or not, whether they're indigent or not. In addition, I want to add the fact that there is between $50 and $80 million added to the state's general fund every year through CMS payments, the Center for Medicare and Medicaid Services from the federal government, that flow to the state's general fund because of our existence. If we weren't here, that money would go away.
Okay, I'm going to give you each 15 seconds each for final thoughts. Mr. Duane, first to you, 15 seconds.
If you look at what this state represents and the populations that we serve, we deserve to have a backstop safety net hospital for the indigent. I didn't mention at all the graduate medical school that we operate. 400 doctors and 1,000 nurses come out of it every year. It's the most robust medical education program in the state of Arizona. All the other hospitals have doctors that come through our programs, and statistically 75% of the doctors that we graduate and nurses stay and work in the valley, providing economic benefit to the tune of $1.4 billion annually.
All right,
this
we'll
is going to be a net gainer
side,
for the
sir.
hospital.
We'll have to leave it right there. And Mr. McCarthy, please go ahead.
Yeah, I can't encourage voters enough to learn more about this and really appreciate the fact that you're looking at a $1.6 billion tax increase for many services that are already being funded through the state general fund. They represent this as being at a low cost. We'll add that to all the other low cost items that sit on your property tax bill, your income tax bill, and think about the added payments that are coming down the road for increased spending for education and infrastructure. There's only so much money in the private economy to provide the needs of Arizona, and we shouldn't double fund anything.
Gentlemen, I want to thank you both very much for being here. Really important discussion. Appreciate it. And when we come back.
Thank you.
You've got Doug Ducey running around the country pleading with the Koch brothers to spend some of their billionaire money in Arizona to influence our elections.
Dark money accusations taking center stage this week in the race for governor. Plus, you'll see it on the ballot. But do you know what Prop 122 actually does? Stick around. We've got both sides debating next on Politics Unplugged.